So for those populations, the flu vaccine does offer effective protection. Other things you can do would include such things as regularly washing your hands with soap and water. Certainly before eating and drinking, and certainly before touching one's face. If you can't have soap and water available, or it's not available to you, using an alcohol-based hand rub is another thing that can be done. Staying home when you're sick is another very important thing that people can do in order to protect others, and trying to use good cough and sneeze etiquette. If you're coughing into your sleeve rather than into your hand, limits the capacity to spread the disease to others.
So for people that are already suffering from a medical illness, how much greater is the risk by not getting a shot? What does it do for them?
Well, it all depends on which illness we're speaking of. So influenza is a disease that tends to impact on the lungs, on the respiratory system. So certainly if you have cardio or cardiorespiratory, heart-lung conditions, those would be conditions that would predispose people to being more susceptible to influenza and to the negative effects associated with them. Certainly if you have immune conditions, that's another, for some reason if your immune system isn't functioning optimally, that would also be another subset of the population that would benefit from getting coverage. But I think people should discuss these issues, again, discuss with your physician, because it's very individual dependent if there are particular concerns around a pre-existing medical condition that one has.
And what advice would you have for people who might be stuck at home with a medical condition, might find it hard to get to a clinic? What advice would you give them?
Yeah, so I think, one, there are a number of clinics that are in and around, or opportunities to access flu vaccine through 600 pharmacies around the city, with a little assistance, hopefully, from a family member or a friend. There might be the possibility of getting out there. And again, I would discuss with your own individual family physician office. Some family physicians are able to provide that service, home-based service. But I think that's very physician, individual practice dependent.
At what point should an individual who's been infected seek medical treatment?
Well, that's a very difficult question to answer in this large context. I think my sense is that individuals generally know when they're not doing well, right? You're either generally with the flu, if you're going to recover, you'll feel unwell for a few days, but you should be starting to get better within a few days. And I think, if there are concerns, we have a number of different services that are available, not the least of which is Telehealth Ontario. A conversation can be had with a trained nurse, describe your symptoms, and they can actually provide that advice, and or to speak with your own healthcare provider around what your specific conditions are, because these things have to be managed at an individual level. But certainly I would say in general, if you're not improving and you're having difficulty breathing and feeling very unwell and don't notice an improvement over the course of days, that those are reasons for which one should seek medical attention.
How important is it living or working in an urban environment? I mean, can you see the flu spreading more rapidly in an urban environment, closer to living conditions, public transportation? Is there any stats behind that?
I don't know that there are stats specifically around that, but we do know that the flu is spread through droplets that are produced by cough or sneeze and through contaminated hands and objects. So the more influenza activity there is in a given community, and if people aren't practicing good hygiene, right, not coughing into their sleeve or sneezing into their sleeve, or perhaps going out when they're unwell, that will contribute to the spread. So it's important to, if you're, stay home from work or school if you're sick, wash your hands with soap and water or alcohol-based hand rub, cough or sneeze into your sleeve. Get the flu vaccine, and this is the best advice we can offer in respect of managing and successfully navigating the flu season.
How
I'm going to wrap it up for now. Sorry.
Just can I have one more? Yeah.
Okay.